have with me on stage Crispin Blunt, MP for Reigate for 25 years now, and former prisons minister, chair of and founder of the Conservative Drug Policy Reform Group, the CDPRG. I should declare my interests in that I do work with Crispin, so he's not going to get the Susanna Reid treatment up here today, hopefully. But I want to kick off by asking Crispin, what possessed you to get involved in drug policy reform? Was that a healthy decision for your political career? How did it come about in the first place?
Well, it came about because I lost chairmanship of the Foreign Affairs Select Committee, another inadvertent victim of the 2017 general election, when the Great British Electorate presented us with a Remain Parliament to implement Brexit, which went really well until we got to the 2019 general election and escaped from the conundrum we'd been faced with. I know it'll go down like a bag of cold stick with this audience probably, as someone who could see the opportunities and benefits of Brexit for the United Kingdom and the long-term discomfort of the relationship between the UK and Europe, I was a supporter of Brexit, and was summarily removed from the chairmanship of the Foreign Affairs Committee by said Remain Parliament elected in 2017. And on the day that election happened, I was then thinking, what am I going to do now? And from my time as prisons minister, I had, as anyone who I hope had been around 77 prisons in the UK and seen our criminal justice system up close, our drugs policy is an unqualified catastrophe in terms of social policy, in terms of health outcomes in the UK, and in terms of cost and victims of crime that are created by our drugs policy. And on the day I lost that election, the government published its latest iteration of its drug strategy, on which I spoke about 5 days later in the House of Commons in a debate just before we rose to the summer recess in 2017. And on the back of the reaction to that speech, I then became the first Conservative co-chair of the all-party parliamentary group for drug policy reform, which has been kicking around since 2011 under the leadership of Baroness Molly Meacher, who will be named to some of you here, a great expert in the international aspect around UN conventions underpinning wider drugs policy, and in a huge enthusiasm then of seeing the developing cannabis industry, medicine from cannabis in Canada and the United States, and a ton of investor money and financial interest in that sector. I then formed up to my fellow officers of this group and said, well, we ought to get some of that money to actually have a proper campaign around drug policy reform in the UK, which can be informed by a decent public affairs capacity, a decent research capacity, and a proper PR capacity. And my fellow officers looked at me and said, what, taking filthy capitalist money? You can't possibly do that. So the all-party parliamentary group was then left with the wonderful efforts of Mike Trace as our honorary secretary, who was a Tony Blair's sort of deputy drug czar back in the early 2000s. And I then decided I really wanted to get capacity into this space, so set up Conservative Drug Policy Reform Group Limited, which is being part of the spectrum prepared to take filthy capitalist money that has an interest in intelligent-based drug policy reform. It's not conservative. It's not part of the Conservative Party, obviously. It's not there to return Conservative candidates in elections. It's there to exercise influence on that part of the political spectrum that is most resistant to change in this area. And we are absolutely dedicated to policy based on evidence. And it's been a wonderful journey then working with people like Dave Nutt sitting in the front row, and drug science and all the other operatives in this space to try and get some capacity at the political level in order to try and change the terms of the debate around drug policy in the UK. And over the course of this journey, over the last 3 or 4 years or so, whilst it was the terrible effect on the criminal justice system and on society, it's then seeing all the foregone opportunities of the medicines we haven't had because of the restrictions we've placed around them. And of course, medicine from cannabis was at the centre of the discussion in 2018, 2019. I'm delighted to say that the whole debate around the psychedelics has now really taken centre stage in terms of potential avenues for new progress. And the signs are that my colleagues are beginning to move.
So we're seeing change in Westminster and in the media, of course, around drug policy more broadly. But here we are talking about psychedelics today, and the CDPRG has produced a rather extensive report on the need to reschedule psilocybin specifically. Why have we done that? Why psilocybin, and why the rescheduling?
Well, it's a rather like cannabis until 2018, when the chief medical officer simply asked the question, is there any medical benefit from medicines from cannabis? Or she was asked that question by the then Secretary of State for Health. And 2 weeks later she came back, well, do you know there is? And 6 months later we produced a regulatory regime for medicines from cannabis, which has set up a quite successful private sector industry. I think we've managed to write 3 prescriptions on the National Health Service in the same period. So that side of it hasn't gone as well as it might have done. But it moved cannabis from Schedule 1 to Schedule 2 of the Misuse of Drugs Regulations of 2001, which means that you can actually do some research on cannabis without it costing you £5,000 to breathe on the stuff. And we had this crazy situation where at the centre of the campaign around medicine from cannabis was this young lad, Alfie Dingley, and it was going to cost the physician who was going to apply for his medicine £5,000 to have a licence to apply for the medicine. It was going to cost the doctor who was going to prescribe it £5,000 for the licence to prescribe it, and it was going to cost the importing pharmacy £5,000 to give it to the people, and another £5,000 to import it. Well, obviously that's utter insanity. And we are still in that place, regulatory terms, with the psychedelics. So trying to do any trials to scale is incredibly difficult. And now, if you're a really heavy-duty big pharma company, of which we're not exactly overrun. We're not exactly overrun from outside with interests from elsewhere, who've got billion-pound deep pockets. They can possibly cope with that. But universities don't hold Schedule 1 licenses. The smaller research companies, it's largely put out of range. But so to actually get through that barrier and get to an intelligent place where there has not been a single example of a medicine regulated under Schedule 2 that has gone from the Schedule 2, doesn't make it stuff legal for anybody. It just puts it in a different regulatory place. There's never been a single example of any of it going into the criminal supply chain out of the medical chain. So what is the purpose of Schedule 1? So we actually need to knock Schedule 1 over and have a proper look at the whole scheduling process to actually get the whole scheduling of compounds into an intelligent and place that actually serves the public good rather than stands in the way of access to knowledge. And that's what we've done over 50 years in respect to the psychedelics. There was the emerging data in the 60s and 70s from the studies that were the trials being conducted in the 60s, and then we put a 50-year block on it. And now it's being looked at again, obviously with the kind of intensity that we've all seen expressed today, and suddenly we're waking up to the fact that we are on the verge of a step change in our capacity in terms of mental health treatment. And some of the things that have proved most resistant to treatment. I mean, it's incredibly exciting and to be part of this space. I knew absolutely nothing about this when I became co-chair of the all-party parliamentary group on drug policy reform. I mean, I was much more interested in trying to stop the recycling of drug-addicted people in and out of our prisons, of the disaster of the replacement of the British system of maintaining people on a prescription, and so they didn't have to spend every minute of every day working out what they were going to steal next to get their next hit, which saw an explosion of addicts to heroin in the UK go from sort of just over 1,000 in 1971, I think, to 350,000 20 years later. A triumph of public policy, probably unequalled, I should think, in any area of public policy.
Something we need to address.
Yeah.
With the campaign that the CDPRG has just set out, and is just beginning to get going with
Yeah.
for psilocybin access rights. I think everyone in the room at this point will be pretty familiar with psilocybin being found in magic mushrooms. Why psilocybin? Why not all psychedelics?
Well, I think the truth is what applies to psilocybin applies to all psychedelics in terms of the regulatory framework, and there's no real argument for not including the others. It's just that the science and the research around psilocybin in the United Kingdom is rather further forward than it was with some of the others. There is, I think, probably more progress in the States on LSD and MDMA than there has been here, but there is work going on here in respect of those psychedelics. So the argument does apply across the piece. But particularly with psilocybin, and particularly having heard it was Keith Abrahams this morning, we've got 7,500 veterans who've come back from service for their country in Iraq and Afghanistan who are suffering from PTSD. 2,500 of those 7,500 are untreatable by current medical methods. And so the opportunity then to open up to treat those people who have been traumatized in their line of duty, in a sacrifice for our country, is then something I think is unanswerable to politicians who sent them there. And that we ought to be straining every sinew to enable them to get their treatment. But of course it applies to depression and the vast scale of effective depression in our country. As we heard, that more than 5,000, I think 6,500 people commit suicide every year in the UK. These are statistics that are actually utterly shaming for the United Kingdom, not to mention another 4,000 people who die of drug overdose. All of which, or very, very many of which, would be avoidable if we had an intelligent drugs policy that was actually focused on the public good, not on delivering a hopelessly outdated form of prohibition.
And and the campaign for psilocybin access rights, there are those in the room who might say, look, Crispin, the science is progressing and the MHRA will eventually provide market authorization, and this is the process and we don't need to interfere with it, and we don't need to communicate with the public around these medicines. What would you say to those people?
Well, I suppose that one of my abiding sins is impatience. And I've now been swimming through treacle on the whole drug policy front, actively engaged in it since 2017. And frankly, we have to pull every lever available to us. And in terms of psilocybin access rights, I want us to... where the hell's the Royal College of Psychiatry? Why aren't clinical psychiatrists actually looking to be able to hugely broaden their capacity to treat their patients? And they exist as individuals, but collectively the Royal College is about as conservative as my own party. It is strangely enough, for some reason, it is not at the front end of this campaign. I don't understand why. So we have found serious psychiatrists and to engage and then to begin to, but we've got to get to work on the medical institutions to actually alert them to what is potentially available to them. And I think the great thing about the psychedelics is you've got all the anxiety about the medical regulators who are then going to be in a space where, well, if we just let this out there, what will happen? But here you've got this sense where you are going to have the medicine that is going to be delivered under supervision of therapists. And so if you can get the supervision of the therapists right, so that how they oversee this, I think you can take a bundle of the risk out for the regulators about the steps that they're going to take. So it's trying to draw all these different strands together in order to deliver what would be a step change in mental health treatment and addressing a whole bunch of conditions which at the moment, if you're lucky enough to be able to get access to the psychotherapy, you're going to pay a fortune for it and it's going to take forever to work. Why on earth don't we do the obvious and use the knowledge we've already got and also open up the route to more knowledge and then accelerate the process to actually having mental health treatment that does our country credit?
I heard one of our colleagues describe this as a penicillin moment. And I know there are many in the room who may fear hype around these medicines. I often describe myself as an evangelist, but that momentum, that sense of urgency to deal with this suffering. How do you think we get the right balance here in the tone between that sense of urgency, driven by need, driven by those individual stories like Keith's that we heard earlier, and making sure that we are being measured and that we are not encouraging people to go out and practice unsafe access to these medicines?
Well, that's obviously the intelligent place to get to is actually about a regulated environment, which is actually going to mean that, and particularly around the psychedelics, is going to be done under the care of a therapist. Obviously, with the ayahuasca ceremonies and the rest, the shaman is a therapist. I mean, that's why have they built up these traditions? Why do they do it in a particular way? Because they've spent centuries learning how to make the thing work. Now, of course, that doesn't necessarily pass the immediate test of Western medicine assessment for those processes, but it is undoubtedly the case, as we heard very movingly from Keith, in respect to the veterans he took there. And I just think we've got to advance on all fronts on this. So every opportunity there is to convince people. And that's where evangelists are really useful, Tara, because evangelists sometimes have the ear of powerful people and it is not a difficult case to make. To explain to people as to why psychedelics, in conjunction with therapy, could be this big change in effectiveness of mental health treatment. And so my challenge to Kit Malthouse, who I'm now laying off slightly for a bit, having shelled him with parliamentary questions through a large part of last year, is what is the evidential base for the psychedelics being in the grouping they are? Can't find any. Was the answer, and you actually then find the evidential base for most of the government's drugs policy is largely non-existent, and it goes back to the prejudice of the 1960s, and it goes back to American attitudes towards their own African American population and their use of cannabis. There's a sort of tabloid view of pop stars using psychedelics, dancing out of windows of hotels or anything else, all of which none of this is based on any evidence at all. But we've got the challenge then of identifying the ways which are actually going to produce comfort for those regulators, that they can start thinking about the good they're going to do rather than the harm they're going to avoid, and actually start thinking about the positive opportunities here around medicines that actually their evidence of harm is, compared to the opportunities of the good, is very, very limited. And so there has to be a slight change in mindset about risk and reward. And I suppose how I put this to Kit Malthouse was, if you don't do anything as the Minister for Drugs Policy, our suicide rate is going to stay where it is. If you do something, there's every possibility we could drop this really quite significantly. Do you want to save those people? Or are you going to be responsible for them dying? Now, he didn't really enjoy it when I put it in the latter terms in the House. But I think he's grasped the fact now that there is an opportunity here to do some serious good. And that's what now gets me out of bed in the morning to go to work with some wonderful people at CDPRG who will provide bullets.
And the Prime Minister himself, when you spoke to him last year, you've publicly said that you discussed the rescheduling and it wasn't a problem.
He told me, I had waited for ages to get half an hour with the Prime Minister to raise my particular points of concern with him. Fortunately, he had appointed an LGBT envoy the day before, so that half of my to-do list I could safely put to one side and focus on drugs policy. And he told me, I got down gave him the list of stuff, and he got to rescheduling Psilocybin, and he said, I did that yesterday. Well, whoopee, I said. I looked at his official and said, well, no, he's just given me commercially sensitive information here. After the meeting, I said, when can you will talk to me so that I can make sure that I say what I'm going to say when this is a controlled release of information. And then answer came a none. And then I had to try and find out what had happened. And I think what had happened is he had approved a paper from his policy unit, which had then gone off to the Home Office to say, do this. And the Home Office came back and said, well, it has to go to the MHRA. There is a process here. We ought to keep to the process. A process they didn't keep to when we rescheduled cannabis, I might add. So there were precedents established elsewhere for doing things more rapidly to more effect. And that process is still being ground through. But if at the same time, whilst we're waiting for an application for a medicine to be authorised, which frankly is, and we're still scheduling the compounds in a place where we make research almost impossible, we're never going to get to a bloody medicine because you haven't actually done the research on the compounds. So fighting one's way through that particular catch-22 is obviously, and pointing that out to people. So then there's now a consultation with the ACMD, who are now going to produce a paper on barriers to research. And so bit by bit, we pick apart the wall that is between us and actually progress in this place. And all I can say is help. My side of the business does need a bit of support and engagement in the public affairs space to get these arguments over. And it's not just on the psychedelics, it's on the CBD industry. There's a £600 million a year industry there that could go down in front of the Novel Foods Directive, which we've taken on from the European Union. Only the Food Standards Agency will, of course, implement it with a great deal more enthusiasm than its European equivalent if we're not careful. So there is a real discussion to be had there in a different area of drugs policy. And this is where and takes me back to the uniting fact that underpins our drugs policy is it has been insufficiently based on evidence and data, and it's been done by too often by what will produce the right tabloid headline, rather than what will actually do the public good here in the UK.
I think, have we got any more time? We have. No, we haven't. No more time, except there's plenty more time to talk to either of us. We'd love to speak to anyone, of course, in the audience that can help and wants to help with shifting things forward, progress in the UK.
And that's and so if I just could finish with a pitch for CDPRG, has been my vehicle to get resources into the public affairs space, given my colleagues' lack of enthusiasm for that. So do please talk to me or any of the team who are all here today to find out how you can get engaged. And essentially, our formula is that we will spend half our time on your corporate objectives within whichever bit of the drug policy space you are in, and accepting that half the time is then on the public good of actually achieving greater step forward to drugs policy based on evidence overall. And so, and I think almost everyone in here is actually motivated by the opportunity to do some serious good. And if you're minded to join into the murky political space to actually try and get the changes delivered, then please do get in touch.
Thank you very much.